Good afternoon. I'm David Summers. I'm the publisher of the Long Beach Post and Long Beach Business Journal. Thank you for everyone out there watching, joining us for our live chat today. We're checking in with Long Beach Mayor Dr. Robert Garcia and Director of Health and Human Services for the City of Long Beach, Kelly Colopy. There's been a lot of news and developments, none of it good the last couple of days around the country of what's going on with the coronavirus pandemic. We're heading into the Thanksgiving holiday and the implications of what that means. So we wanted to check in with our city leaders today and also get an opportunity to let you ask your questions out there. If you're watching these feeds live, please go ahead and send your questions in right in the comments on our social media feeds, wherever you're watching this. Our newsroom keeps an eye on those questions and sends them my way, and I'm happy to ask them to Kelly and the mayor. I want to get started this question to you both. On Sunday, the latest numbers out of the county was that there were more than 3,000 new daily cases announced in LA County. That's 3 times higher the daily count from just a little over a month ago when we were seeing 900 to 1,000 cases a day. Yet my own personal reaction is that I don't seem to be that people are 3 times more cautious or 3 times more diligent in their personal actions. Are either of you concerned about how individuals are responding or not responding to this increase? Are people underreacting?
Well, thanks. Thank you first to the Long Beach Post, Dave, to you. And of course, I'm always glad to have these forums, opportunities with our health director, who does a great job. Let me start just by saying that the answer to that is yes. So people should be more concerned today than they have been. I mean, we think about the spike that happened a few months ago and that intensity, that's where we are headed if we do not do better. People are becoming too complacent. There's too many gatherings within homes that are happening. We know we've had some sporting events and some holidays that have caused us issues as well. But at the end of the day, we have also been fighting against mixed messaging. And I'm very aware that some of the messaging that's come from the national level and some of the actions that have been counter to our messaging of wearing a mask, of social distancing, of doing the right thing. So that has been a struggle for us, but we're going to continue to push as best we can. And folks should know that right now, cases across the country are at an alarming historical rate, and that we are on a trajectory as a country to break records, to have more people die, and it can happen here in California if we don't watch out.
Kelly, you're our city's top health official. What are you and your team seeing about how people are responding and preparing locally?
Yeah, so we track the numbers every day, of course, and what we're seeing is during as things had sort of stabilized at their lowest that we had seen, we were getting daily reports of maybe 45 a day. We're now seeing reports about 120 a day. So our numbers are, they look like LA County's numbers in terms of how they're starting to go up. And I think it's so important. What I am noticing is I see more people wearing face coverings when they're out. I see them when, just generally, and the state has come down with new masking guidance, basically saying you should have a mask with you at all times. And anytime that you are near anyone, you should have one on inside or outside. And they're required. And then they're really talking about, when you're at restaurants and other places where there are more people, is to make sure that people, a lot of times what you'll see is people will go to a restaurant, Long Beach, that's always outside. The minute they sit down, the mask comes off. And then they have the whole 2-hour meal. And then the mask goes back on as they get up. And instead now it's the mask stays on except for when you are actually eating or drinking. So any other conversational time, all those kind of things. And it's hard. I mean, we've been doing this thing for a long time and the numbers are going up and it's getting colder and people want to be inside and we understand that, but it's just so important right now with the way that the numbers are going up that people really pay attention to their masking guidance and doing everything they can not to gather inside.
Mayor Garcia, Kelly talked a little bit about indoor dining. There was a proposal that came up last week from a few members of City Council to look at lobbying efforts to potentially lobby to return to a certain level of limited dining capacity at some point in the future. Is that still on the books? Is that happening? Is that a good idea or a bad idea at this point? What are your thoughts on that, and what do you think is going to happen with that proposal?
So that item actually has been pulled from the agenda. So I'll be removing that item from the agenda at the top of the meeting later today, which I think is the right thing to do. It's I spoke to two of the three of those authors, and I shared with them what I've told others, which is could not support that proposal. I think that we are in a situation here in Long Beach where we have not had indoor dining to keep people safe. And now we have counties all across the state, including Orange County, Sacramento, San Diego, that had opened indoor dining, and they're now all having to close completely all indoor dining or indoor fitness. That disruption for the workers and for the businesses is substantial. And in talking to mayors and other communities, they are going through a horrific process in now rolling that back and what that's causing to the community. Now, let's be clear. This is a very difficult time for small businesses, for restaurants, for workers. It's awful. Nobody wants to be going through this. I also want to make sure that we're being honest and upfront with people. Saving lives is the priority. Ensuring that our hospitals are not full is the priority. Making sure there's a ventilator, if your mom or your grandparent needs one in our hospital, that is the priority. And we'll do everything we can to support our businesses, but we at this moment, we cannot be advocating at a time when you have cases skyrocketing across the state and the country.
Kelly, you talked about that this has been going on for a long time. I think we're all feeling that. It's been about 9 months since the city started responding locally to the pandemic. And a question first to you, and then Mayor, if you want to weigh in. How has the city's response evolved over time? What do you and your team know now that's starkly different than what we knew back in March? Where are we in terms of responsiveness today from where we were back then?
Well, back in March, our team has done a lot of public health emergency planning for a long time. And we knew the structures, we knew what had to be set up, but the testing labs were all new to COVID. We didn't know about masking at the time. The research wasn't out yet. The decisions made around what could be open or not, everything was sort of just new. And this was a virus no one knew anything about. We now have the capacity to test 1,700 people a day through our test sites. We can, we have appointments available often same day and definitely within 3 days available as drive-ins. We take people if they walk up. So our testing is really in good shape. We have storage and supplies around PPE. When it first started, there was such a shortage, and now we know what to do, and we were monitoring our burn rates, and we pay a lot of attention to that different work. We're also spending a lot of time in partnership with our hospitals, our region, and others. And I think in terms of what we pay attention to, in terms of what opens and gatherings and those sort of things, we pay attention to the science. And there really are risk levels associated with the different fields, and whether you're indoors or outdoors and all those things. And those are all new. And we've been learning them along the time. So we feel like we know more now. We can be much more focused on the areas that we know work the best, and we're really more able to do that going forward.
We're starting to get a couple questions in from people watching live out on social media. If you're out there and you have a question, please add it in the comments. We're speaking with Kelly Colopy, Director of Health and Human Services for the City of Long Beach, and Long Beach City Mayor Robert Garcia. Some of the questions coming in are kind of about the news that we've seen the Board of Supervisors for LA County talking about the idea, say, of a curfew. Is a curfew or more restrictions to business hours, are those under consideration in Long Beach at this point?
I'm happy to, and Kelly, maybe you want to chime in also. I think in my conversations with our health director and others, I mean, we're at everything is on the table approach. I don't think we want to roll back. I think we've kind of maintained where we are for a while. We certainly don't want to implement curfews. We don't want to have to move backwards. But our approach is that we're going to do whatever it takes to keep people safe and not get to a point where we're back to this massive emergency where we have a lot where our hospitals are really hitting any sort of capacity level. So everything's on the table, but we're hopefully we don't have to get there. I don't know, Kelly, do you have anything to add to that?
No, I think there's a conversation. There are conversations taking place at a county level, at a regional level, but also at a state level. And as the state is seeing the increases across the state, so there are now 41 different counties moved back into the most restrictive tier. 41, and there's 58, right? So there are very few opportunities where people are any less restrictive now, and that's really, the state called it putting the brakes on, and so that's where we are. If those don't have the impact, then the state was likely to come back also with more restrictive criteria, and so we're doing everything we can where we are now to make sure that things stabilize and that we can hold and that we can support people as much as possible where we are.
So we talked a little bit about the county and the relationship. One of the things that comes up often through our newsroom is the question about, well, Long Beach has its own health department. Why? Can you, Kelly and Mayor, can you talk a little bit about the importance of going with the county, of the county's role in setting the agenda and what the restrictions are, and why we have to act broad based on these things versus doing our own thing as a city? Because I think it's an important reminder about that we're part of a greater good and a bigger picture than just Long Beach.
Yeah, I mean,
Yeah,
I think, oh, sorry, you want to go ahead first, Kelly?
Well, I think the first thing to understand is that at the state level, they have identified the ability to move at a county level. So it's the same thing in Alameda County with Berkeley and with Pasadena. So they basically, because when you live within a broader county structure, you travel a lot across borders. So a lot of people who live in Long Beach, they work in LA. A lot of people who work in LA live in Long Beach, and people entertain across. So there's a lot of movement. And so what we're trying to do is be as consistent as possible in that space. But we are not allowed per state order to move outside of a tier more quickly. So if our numbers were at a level that were sufficient that we could have been in a less restrictive tier, which they haven't been, then we would have, been able to do that. Within the tiers themselves, we have some capacity. We cannot be less restrictive, but we can be more restrictive. Okay. And so if those numbers, if the information comes out and we start looking at our numbers and we realize that we really need to take some additional restrictions, we can do that more locally, but we do try and align in terms of what is open to make sure that people are following the rules depending on where they live and work together, and that we're making sure that we don't have a lot of people crossing over different boundaries for different efforts.
And again, to be clear, I think that I get asked this question all the time. The state has made it very clear that the reopenings are being guided by the state system, which is the color code system, and that it's done at the county level, not the health department jurisdiction level. But we can be more restrictive. I think Kelly just mentioned that as well. It's really important that this approach to COVID-19 is not done in a way that's narrow, but we have to think broader. I mean, these are really regional approaches are what really work, because we know folks are traveling all over the place. So that's we can't just think within our city borders. It just doesn't work that way.
A couple more questions coming in from the public, and I do want to talk a little bit in a minute about Thanksgiving and what that means and what people should or should not be doing. But first, a question for each of you. First, Mayor, a question from somebody expressing concern about the federal government providing assistance for the people. What's being done to assist Long Beach residents and small businesses locally through the pandemic?
At the federal level, or is this the city level?
They're concerned about they think not enough being done from the federal government. So can you talk a little bit about what's being done to assist locally? How is Long Beach leading, and what are we doing?
I mean, that person is 100% correct. So the federal government is doing very little, in fact, to help cities and to help us here in Long Beach. And we have had to really take a go at it ourselves approach, and working with the state and going out and getting our own tests and setting up our testing centers and all this the work that we've had to do. We're very, very fortunate that once we were left again out of the congressional bill, the last big one, that we were able to lobby the governor and the state to bring in some resources so we can implement some programs and take care of some of our nonprofits and some of our clinics. But the broader picture here is that we have folks that need direct income relief that aren't getting any. We have businesses that need a second round of grants or loans that aren't getting any from the federal government. We have hospitals that are underfunded. We have public schools that we all understand we should focus on reopening safely, that many of which don't have the resources to do so. So there's a lot the federal government can do, and we're going to push really hard with this next administration to put together a really strong relief package that will able to do a lot more for the city.
Kelly, a question from the public for you about CARES Act funding and the Black Health Equity Project. Is there any update that you can provide on the project and where the funding utilization is at this point?
Yeah, so I mean, overall, I'm gonna step back for 1 minute just about overall about the CARES Act funding. So the CARES Act funding, there are a number of different sort of categories for which we are funding. So it includes, food insecurity and meal delivery, supports for our older adults, supports for early child. You've been seeing a lot about different kits, like learning kits and diaper distributions and all those kind of things for the early child, support for nonprofit organizations, support around Black Health Equity Fund. There are a number of different pieces, and we've gotten out about a third of the CARES Act dollars into the community that we have been able to go through. Now, the CARES Act funding at the federal level has very tight restrictions. And so in ensuring that we are meeting those restrictions, it is taking us some time to get those dollars out the door, and people are concerned. We're hearing about it. We know there are a lot of people out there, they're in need. We want to get the dollars out. So we're doing everything we can to get the information, to get the dollars out. In terms of the Black Health Equity Fund, we have funded the Black Health mental health sort of strategy within that. There are two other large strategies for which we'll be having RFP out in the next week or so, and those funds will go out the door. They're going to be available to focus on services coming, that need to be done moving into the future, but also they'll be able to support services that have happened, to be able to support the organizations who are providing the different services. That's not just for the Black Health Equity Fund, but also for nonprofits and other in the community, as we know it's just so important. So we know there's frustration in the community. We are hearing about it, but we also, we want to make sure that those dollars, once they're out, they don't have to be like that everybody, that they remain in the community, and that we're following the CARES Act strategies and requirements as much as we possibly can to make sure that those dollars stay within Long Beach and throughout this process and stay within our community.
We're heading into Thanksgiving. I know in our family, we've canceled our Thanksgiving plans because it's just not the time to do it. But the question that I have for both of you is, how do you sway public opinion about changing behavior, changing how we do holidays when you can't police people's actions in their own homes? You can't go in and count how many people are around the dining room table. How do you tell people about what they should be doing? What should people be doing for Thanksgiving?
I think that we do things like this, and I think our media partners are really important. I think at this moment, I think a lot of us are trying to get out as much as possible to communicate with the public about how dangerous it is to gather at Thanksgiving. And I've shared my own personal experience with this Thanksgiving as well. I mean, this is going to be the first one where I'm not going to have my mom and my stepdad at the dinner table. And for all of those that enjoy having their family over for Thanksgiving, they should be thinking, you know what, this 1 year I'm going to sacrifice, have Thanksgiving with my immediate family unit so that I can enjoy all the future holidays with them in the year after and the year after that. And I think there's going to be a lot of families across this country that are not going to have their family members at the table because of COVID. And I think that they should internalize that. And if you really love your family, if you really love your grandparents and your mom and your dad and you want them to be with you, then this is a year that you don't see them for the holidays.
Kelly?
And I also think, people think, well, I know these people, right? These are the friends that I'm normally with. I can, we see each other all the time. We know it's safe. Like there's this feeling of, if we're close enough friends, we all know we're being safe, but you don't know where others are. And you never know when someone shows up at your door, if they were following all the practices and being as safe as possible. I think what we're really asking people to do is, one, as the mayor talks about, is just sort of sacrificing this year and just realizing like I'm only with my immediate family as well. I used to be the house where everybody came who didn't have family to go to. Not happening this year, right? So, but I also want people to really look at the risk, right? So if making sure that you are, if you decide to gather, even in the smallest numbers, even if it's just your family, that you are outside. You make sure that you're doing everything you can, because I think so often it's like weigh the risk. So if you're somebody who is, who might have an underlying health condition or has a parent that you spend time with and all that, like really weigh the risk. Is it worth it to you to be able to, one, expose yourself, and then the potential of exposing others? And I think if people can sit with that and just understand that this is the year to really look at all of that. And then, no indoor gatherings, please. If you absolutely are just completely like focused on the fact that you have to be with folks, make sure you are outside. Make sure you have all your distancing. Make sure you are wearing your mask, except when a fork is in your hand and you're eating, right? Like all of those different things, there are ways that are much safer than others. And so if you are just bound and determined that you must be with others, we ask that you really, you do pay attention to all the safety practices to mitigate the risk as much as possible.
We've got just a couple minutes left. I do want to get to another question from the public, and a question I had myself is about ICU capacity and hospital capacity. Let's talk about hospital surge capacity. Mayor Kelly, how is capacity at Memorial Medical Center at St. Mary? I know that we've had some of our operations have spun down with our surge capacity, but could we spin things back up if we need to? How are our hospitals doing right now?
Yeah, I mean, the truth is that we do have capacity right now. I think we've got about around 40 folks currently hospitalized for the dashboard. That number can go up, and probably will go up because of some of the numbers. But we have room in our hospitals. We have plenty of ventilators. We have surge capacity, not just at our hospital sites, but our other locations that we can ramp up if we need to. So we are prepared, but we don't want to put our hospitals in that position. So I just think people just need to stay safe and be safe this holiday season, especially Thanksgiving. Kelly?
So we just, on average, like throughout all of this, our hospitals have been sort of in the 56% hospital capacity is how much is being used. And right now we're at 60. So we still have quite a bit of capacity left. We can ramp up alternate medical sites within 24 hours. We have sites. We actually have a mobile hospital. They're large tents. One of them is actually being utilized as our rapid assessment clinic, but we can shift that around if we need to. So we can set those up at hospitals. We have hospital beds and other sort of mobile units we can set up very, very quickly. So we are ready in the case that we need to be, but we'd prefer not to have to go that direction.
The last two questions, I want to end on talking about the vaccines for a moment, but interesting question just came in. Are any measures being taken to mitigate Black Friday shopping or what's going to happen at our retail stores on Friday? Any discussion of that and what might happen here in Long Beach?
Well, per the state order, places are only supposed to have a 25% capacity in any retail. And so that is being reiterated. And then for those who really, who want to do that, then the retail locations are expected to have you go places, you see the dots outside that show the every 6 feet. You walk into a store, you see so all of those things are in place, and we need to understand 25% capacity is all that is supposed to be in a building. We're also seeing a whole lot more of online shopping and things, but we encourage folks to really, if you're going to go, make sure that you are really, holding your distance and be paying a lot of attention to what's going on, and that all the businesses require that masking is going on.
Can I add one thing, Dave, to that? And I think this is really important this holiday season. And I've committed to this. I try to do this every year, but especially this year. If you're going to do your holiday shopping this year, can you please support local Long Beach small businesses? They're really struggling. They really need support. And a lot of them have now converted to they have online platforms. You'd be surprised how many of your favorite local small businesses you can actually order online. You can also, of course, visit them in a way that's safe. You can make a order over the phone. You can visit them when if they're keeping their distance and make sure you're masked and that you're safe. You can also order from all of our restaurants. But this holiday season, I think, and we're going to talk about this some in the future, but all of us in Long Beach, we've got to reinvest back in our local Long Beach small businesses. They really need our support.
Last question, Mayor. I wanted to talk about, there's been a lot of positive news on the vaccine trial front. That's going to have massive implications on the logistics locally. Have there been any discussions at the city level or within the health department, Kelly, about what that rollout would look like? How would we vaccinate the city, and how would that work locally?
Oh, absolutely.
I'm gonna let Kelly answer because we've been meeting about it, but she probably knows the plan.
So our team has been in planning process for the last 3 months. And so we have been in practice. So the drive-in flu pods that you hear, like you get your free flu shot, that is all practice for how you get your free immunization when it's time. So we've been practicing for years about the ability to do large-scale vaccination. We are paying attention. So the Pfizer, which is the first one out of the gate that you were hearing about, right? It has to be held at very, very cold temperatures, minus 80 degrees. And so it requires a whole different, sort of infrastructure to be able to monitor. So we're working on purchasing the appropriate infrastructure to be able to do that and to be paying attention to all that. There is another one that is Moderna is just coming out. And that one requires a different sort of thing. So we're paying a lot of attention to the different vaccines as they're being prepared, what the infrastructure has to be to maintain them. So far, all of them require 2 doses. So we are working on what is the technology and the tracking and the communication system look like to be able to support people. If you get a Pfizer dose, you don't get to go to Moderna for your second dose. You have to stay within them. So all of these different things are in place and are in preparation. They're also, you're hearing that they come in tiers. So certainly people who are, our doctors and our nurses who are treating people with COVID are absolutely your first tier. And then your first responders and others. So we're identifying with who those populations are, what the communication and the outreach will look like, and then partnering very closely with partners that we've had in the past that have helped us be able to do the vaccination. So the school district, our university systems, our hospitals, some of our large companies, and others that have space and capacity to be able to help us do this. Starting as today, we've been in planning for a long time, but we're broadening that effort. And as of today, the task force is launched with all those additional partners to be able to make sure that we can vaccinate everybody as quickly as possible, as soon as they're available.
Very informative, wise counsel about how to stay safe and what to do and not do over Thanksgiving. Dr. Robert Garcia, Mayor of Long Beach, Kelly Colopy, Director of Health and Human Services for the City of Long Beach, thank you for joining us and updating our readers and viewers today. I'm David Summers. From all of us at the Long Beach Post and the Business Journal, we will sign off there. Thank you very much and have a good afternoon.
Thank you.
Thank you.
Thanks for having us.